Hello friends, welcome to second lecture on coronary occlusion. This lecture is a continuation of our last lecture, and before proceeding further, let's have a recap of things we have already learned. So in last lecture we have seen that coronary arteries supply oxygenated blood to heart muscles. The word occlusion is derived from Latin word oculus, which means to shut up. In medical terms, occlusion means blockage or closing of a blood vessel or hollow organ. So, obviously, coronary occlusion means blockage of coronary arteries. The blockage of coronary arteries will lead to ischemia. The word ischemia is derived from two Greek words, ischene and haima. Ischene means to keep back and haima means blood. So, ischemia means to keep back blood. It is called so because blood does not reach organ, that is, it is kept back. So, technically, ischemia means an inadequate blood supply to an organ or part of the body. Simply saying coronary occlusion leads to ischemia, which is called as ischemic heart disease. To simplify things, we will use term IHD, that is ischemic heart disease, in following description. But all this description applies to coronary occlusion also. Further, we have seen that there are three main causes of ischemic heart disease, namely coronary atherosclerosis, second superadded changes in coronary atherosclerosis, and third one is non-atherosclerotic causes. We have already seen that coronary atherosclerosis means hardening and narrowing of coronary arteries. Now we will move further and we'll have a look at the second cause of ischemic heart disease, that is superadded changes in coronary atherosclerosis. From the name it is clear that this cause is an extension of previous cause. Superaddition means the act of adding something in excess. So here some more changes or complications occur in already existing coronary atherosclerosis. Coronary atherosclerosis is already causing ischemia, but these superadded changes exaggerate it. These changes may cause acute myocardial infarction, unstable angina, and sudden ischemia. So, these changes may cause acute myocardial infarction, unstable angina, and sudden ischemic death. Now, we will look at these changes one by one. First one is acute changes in chronic atheromatous plaque. The word acute in medical terms means severe but of short duration. So here coronary atherosclerosis is old, but some severe and recent changes occur in it. These acute changes are plaque hemorrhage, fissuring, or ulceration. What is fissure and ulceration? We will look at later. Hemorrhage means an escape of blood from a ruptured blood vessel. Fissuring means split of a thing to form a long narrow opening, and ulceration means break on skin or surface of an organ. So fissure means split of something to form a long narrow opening. You can see in this image there is a split in this to form a long narrow opening. Ulcer is also a type of ulcer is another similar thing, but it is more deep and wide. You can look in this image and see the difference between fissure and ulcer clearly. Fissure is long and narrow, but ulcer is deep and more wide, more bigger. Okay. So all these three changes causes release of some mass in coronary arteries. This mass is made of plaque and blood. This mass is called as thrombus. This thrombus travels in coronary artery. This thrombus travels in coronary artery and lodges somewhere. This thrombus travels in coronary artery and lodges or settles somewhere. This process is called as embolization. That means process of thrombus detaching from plaque and traveling and lodging someplace somewhere. It called as, this process is called as embolization. You can guess that this thrombus will lodge at a place which is narrower than its size. So it moves the thrombus will move freely until it reaches a spot where the lumen of the artery is narrower than its size. So obviously it will not be able to move any further and will settle down there. So this thrombus travels in coronary artery and lodges itself where coronary artery is narrower. Now you can see that wherever it lodges or settles, it will block blood flow. It will block blood flow from that part. So this is the mechanism how acute changes cause coronary occlusion. Now coming to second superadded change in coronary atherosclerosis, it is called as coronary artery thrombosis. We will look at second changes, that is coronary artery thrombosis. In first superadded change, we have seen that we have seen causes which form thrombus. Now in this second superadded change, we will look specifically at thrombus formation in coronary artery. Coronary artery thrombosis causes transmural acute myocardial infarction. Myocardial infarction is also known as heart attack. Commonly it is known as heart attack, but technically it is called as myocardial infarction. It occurs when blood flow decreases or stops to a part of the head, causing damage to the heart muscle. You already know that every part of the body needs blood supply. If blood supply to any part of the body is stopped or blocked, that part will be damaged. Similarly, this occurs in heart muscles also, that if blood flow to any part of the heart muscle stops or blocks, that muscle is damaged. This is called as myocardial infarction. Now what is meaning of transmural? Because we have mentioned that it causes transmural myocardial infarction. So mural means related to wall, WALL wall. Mural means related to wall. Trans means across. So transmural means across wall or involving complete thickness of wall. So transmural myocardial infarction is that myocardial infarction which involves full thickness of heart muscles. So to sum up, like you can see in this image, that this is heart muscles or myocardium. So you can see that 1 minute, here this part is this part doesn't get blood supply, and this whole thickness of heart muscle is involved and it is damaged. So this is called as transmural, which involves whole thickness of cardiac muscles, because it is across the wall from this wall to this wall. This is across the wall. So this is called as transmural. So the transmural myocardial infarction involves full thickness of heart muscles. So to sum up, coronary artery thrombosis causes myocardial infarction which involves full thickness of heart muscles or myocardium. Myo means muscles and cardium means heart. As we have already seen, this thrombus is formed due to ulceration of chronic atheromatous plaque. Ulceration means break on surface or skin. So here surface of plaque breaks and this broken part settles in a narrower part of artery and causes complete luminal occlusion. The term lumen means inside space of a tubular structure like artery. So this thrombus completely blocks lumen of coronary artery. This stops blood supply to that part of the heart muscle, resulting in damage to that part, and it is called as transmural myocardial infarction. So this is second superadded change. Now we will look at the third and final superadded change, that is local platelet aggregation and coronary artery spasm. In this case, platelet aggregate on atheromatous plaque. Aggregation means combining of several separate elements. So you already know that platelets flow with blood in blood vessels, and due to some reason they start collecting on atheromatous plaque. After collecting on plaque, they release some material which causes vasospasm. Vasospasm means spasm of vessels. Spasm means contraction, so contraction of vessels. So due to this spasm or contraction, lumen of coronary artery becomes narrower, and obviously because lumen is narrow, then it will lead to reduced blood supply, or in other words you can call it coronary occlusion. So this was second cause of ischemic heart disease. So far we have discussed two causes of ischemic heart disease, that is coronary atherosclerosis and superadded changes in coronary atherosclerosis. In next lecture we will look at the third and final cause of ischemic heart disease, that are non-atherosclerotic causes. So this is it from me today. If you have any doubt, kindly ask in comment section. Also do give your valuable feedback. Thanks guys, take care, see you in next lecture.